Hi, I'm Dr. Suraj Muralidhar. Today we will discuss about how the prostate causes disturbance in the flow of urine, what is uroflowmetry, and how we can diagnose the prostatic enlargement and its symptoms. First of all, prostate does cause urinary disturbances. Prostate, it's a gland which sits like a donut around the urethra, which is the tube which carries the urine out from the bladder. Whenever the prostate enlarges in size as the age increases, it presses upon the urethra and compresses it. This causes various urinary symptoms, like first of all, there is frequent passage of urine, urgency, sometimes even associated with urge incontinence, nocturia or passage of urine multiple times at night, hesitancy to pass urine, poor stream or a weak stream, intermittent passage of urine, straining while passing urine, and sometimes even incomplete passage of urine. So all these symptoms, they suggest prostatic enlargement and the compression of the urethra causing all these symptoms. Now, let's talk about a test which is used to know the speed of your urine, called as uroflowmetry. The name might sound fancy, but however, it is a very simple, straightforward, non-invasive test in which we can know various factors of how the urine flow is affected. We'll get to know the flow rate of urine, the average flow, the maximum flow of urine, the total volume of urine which is voided, and many other factors. First of all, how it's done. So we ask the patient to come with a full bladder, and there is a special funnel shaped device which is electronically connected to the computer, and this is called as the uroflowmetry machine, and the patient voids into this funnel. There is a sensor with a can attached. So here it will sense the rate at which the urine flows, and finally we get a graph along with it's mentioned about the average flow, the peak flow, the total duration, and also the total volume of urine which is voided. This is usually analyzed by a urologist, and then he explains regarding the further types of treatment for that particular condition of the patient. Normally, we can say about 15 ml per second or above is quite good, and there is no signs of any obstruction. However, 10 ml per second or lesser on uroflowmetry suggests that there is a significant obstruction and the patient requires treatment for this. We usually combine this with measurement of post-void residual urine, also called as PVR. Here we'll get to know what amount of urine is left inside the patient's bladder after he has completely voided. So now we'll come to the diagnosis of prostatic enlargement clinically. When the patient comes with all these symptoms, we do a per rectal examination, also known as a digital rectal examination, where we'll get to know how much the prostate has enlarged in size and whether there is any suspicion of future cancer, and also certain other characteristics like whether there is any presence of infection or pus in the prostate. So this is a very simple clinical test to diagnose the enlargement of the prostate. Along with this, we do a uroflowmetry where we'll get to know the various aspects like the flow rate, the maximum flow, the average flow, etc. We can do a serum PSA examination or a prostate specific antigen value, which suggests whether it's only a benign enlargement of the prostate or whether there is any suspicion of cancer or malignancy. Certain simple urinary tests like a urine routine and a urine culture, it helps us in knowing whether there is any infection. Like for example, if there is more pus cells or bacteria in the urine, or whether there is any blood in the urine. So all these suggest it could be an infection, an enlargement of the prostate, sometimes even prostatic cancer as well. So yes, prostatic enlargement can definitely cause problems with the flow of urine. However, early diagnosis, consultation with the urologist, and proper treatment along with medications and if required surgery will help in leading a very healthy life.